Newark area pastors speak about African Americans and the COVID-19 vaccines. Brought to you by the Aging and Brain Health Alliance at Rutgers University-Newark, with support from the NIH's National Institute on Aging. We asked these 8 pastors, Reverend Maria Crompton, Reverend Dana Owens, Reverend Paul Martin, Reverend Bryant Ali, Reverend Glenn Wilson, Reverend James Bailey, Reverend Robert Cole, and Reverend Jacqueline Robinson. 2 questions. 1. What are you telling your congregation about the COVID-19 vaccines? And 2. Do you and your family plan to get vaccinated? This is what they told us.
So COVID-19 has been difficult for everyone across the board, but it has been especially difficult for the African American community. The fact is, the truth of the matter is, Black people have been disproportionately impacted by this pandemic. And so as the pastor of a predominantly African American congregation, I take seriously the health and well-being of the members that I am called to serve. And so at Elmwood, I am encouraging all of our members, particularly those who are 65 and older, those with pre-existing conditions, to schedule an appointment and receive their vaccine as soon as they can. And to those people who are hesitant, for those who are fearful, I am encouraging them to speak with their doctors, ask the questions that they need answers to, get all of the information they need to make the best decision for their health. In terms of me and my family and our plans to receive the vaccine, absolutely. Absolutely. We don't qualify to receive it now, but as soon as it becomes available to us, we will be receiving the vaccine.
Based upon the history of medicine and African Americans in this country, there was a hesitancy as to whether or not they should trust it, whether they should get it. And so I've been trying to convey that message of trust in terms of believing in the science and believing that this will not have any irreparable harm upon us as African Americans, but then also just from a return to a sort of a normal living kind of thing, that the vaccination should be taken by everyone when it is possible, so that we can sort of resume our way of living, our way of worshiping, our way of socializing, which I think will then ease the stress, the mental stress that many of our congregants and many of in our community are going through. So I'm encouraging our seniors, most importantly, to get it done ASAP. It's important for me because when this first broke, when COVID first spread in this country, my wife and I were we contracted it in March. And so we went through all of those symptoms. For me, it was an extended period of time. And so my wife and I are planning to take it. And now we're just trying to coordinate when to do it. But we're definitely going to take it.
I would love to get back to in-person services, but I realize we can't get there until this pandemic is behind us. And so I'm encouraging them to wear their masks, to stay social distance, and register for the vaccine and take the vaccine as soon as possible. You don't have to trust the politicians, trust the scientists. You don't have to trust the politics, trust the doctors. Well, my family has been personally impacted by this COVID virus. We are right now trying to nurse our daughter back to health. And because of that, we have every intention to take the vaccine as soon as possible. So everyone in our household has already registered, and as soon as it is available to us, we will take the vaccine.
Okay. I'm telling my congregation to do the research, not to listen to the naysayers or those that are in favor, but to do their own research and come to their own conclusion in conjunction with their doctor's advice. My wife and I have already had our first shot. So we're waiting to get our second shot beginning of next month. Because of my pre-existing conditions, I took my advice that I gave the congregation. I conferred with my pulmonologist, and he recommended that I get it. He said,
as an educator by profession, I myself had numerous questions as to the validity of the corona vaccine. I had the opportunity to conference with doctors, scientists, researchers, and health professionals who were able to bring light to my satisfaction. Therefore, my message to the church members and community that if you wish to, again, to fellowship with family, friends, and neighbors and church members, the vaccine is the way to go. And to answer the question, would I myself take the vaccine? I would certainly do so. Thank you, and God bless.
Well, I'm telling my people, the ones who up in age, 60, and most of them are up in age, they're 60 and over. I am telling them that when their opportunity comes, please take the vaccination. And I know they're leery about it, and all of us are still leery about it. But this is the only protection that we have right now. That's me and my family will be getting the shot. Me and my wife, we will, and my daughters, we will be getting the shot as soon as the opportunity arises.
What I have been telling my congregation since the inception of the vaccination is pretty much what the Apostle Paul told us, let every man be persuaded by their own mind. And I realized why I was on the fence, because I didn't educate myself. I didn't get enough information. And so I began to pursue that information. I began to search for the data. I began to research the science. Then there's others that believe that they are invincible, but I encourage them to search their hearts, do their homework, do their research, and allow their decision to be made solely by themselves, but be persuaded by their own mind. And that's how I leave it with my parishioners every Sunday, by getting the vaccination, not only protecting myself, but protecting my wife and my girls, and to allow them to see me live just a little longer. I think I owe it to myself. So yes, I plan on taking it.
It's very important that you make that decision concerning your health, what you feel is best for you. And most of the time, when it's something good for your health, you make that decision, I want to get better. Make sure you see your doctor. Make sure you make that decision and be persuaded by your own mind. As far as my family and I, we do have some family members who have taken the shot, the vaccine. They have had no repercussions with it. Everyone has been doing fine. Some have taken the second shot. I have not had it as of yet. My job offers it when my turn comes up.
As you saw, all 8 pastors agree on 4 things. 1. Do your own research, come to your own decision. 2. Talk to your doctor or other healthcare provider, get their advice. 3. All 8 pastors have or plan to be vaccinated themselves. 4. The sooner we all get the vaccine, the sooner we can return to the joys of being with our family, our church, and our community.
And I wish to thank each of the other 7 pastors and their participation. Bless each and every one of you. We're looking for great things to happen in 2021. Amen.
This video was created by Dr. Mark Gluck and Reverend Dr. Glenn Wilson Sr., with Diana Grass, an undergraduate honors college student in the Gluck Lab at Rutgers University-Newark. If you'd like more information about the Aging and Brain Health Alliance, go to our website at www.brainhealth.rutgers.edu or call and leave a message at 973-353-3673. That's 973-353-3673.